and gentlemen, to begin today's ceremony, I would first introduce you all to our Honorable Principal, Professor Dr. Salma Aslam Kundi. Her distinguished journey in medicine began with an MBBS from Khyber Medical College. She earned a master's degree in physiology from University College, London, UK. She rose through the ranks with distinction. She has served as Professor and HOD of Neurophysiology, along with Vice Principal and Dean of Ayub Medical College. She is a dedicated researcher and scholar with numerous publications to her name, primarily focusing on pioneering work in neuroendocrinology. She is a visionary founder and patron of the PARC Cancer Support Group, Crucial Support to Cancer Patients. She has served as a district chairman and now as a national representative for Inner Wheel Pakistan, one of the world's largest women's service organizations. She was also the first president of Pakistan Medical Association, the second woman to hold that position after Dr. Yasmin Rashid. I would like to invite our respected principal, Professor Dr. Salma Aslam Kundi, to kindly come up on stage and share a few words with us.
Bismillahirrahmanirrahim. Allahumma salli ala Muhammadin wa ali Muhammad kama sallaita ala Ibrahima wa ali Ibrahima innaka Hamidum Majid. Distinguished guests and our chief guest, Dr. Johar Ali, who is the Vice Chancellor of Peshawar University, our keynote speakers, starting from Dr. Mubashar Iftikhar, who is a whiz in IT. He has established the Sadiqan International Virtual University's IT network and is now working with the Pakistan Army on different projects of IT. Dr. Saira Afzal, a dear friend, and she is the head of the Pakistan Institute of Community Medicine. It's the IPHS in Lahore. And yesterday she was telling me this was established before Pakistan was made. And they used to make vaccines for smallpox, vaccines for typhoid, cholera. I don't know where we went wrong down the lane. And for corona vaccines, we had to look up to other people. The corona reminds me, Angelique Acoetzee, another friend of ours from South Africa, discovered the Omicron virus in corona. So she's well renowned for that. Thank you for coming all the way from South Africa. Angelique, we love you. When she was the president of the Medical Association South Africa, at that time I was the president of the Pakistan Medical Association and we bonded. Then my dear brother Ejaz, who's also my class fellow, is now the Vice Chancellor of Gandhara University, and my little sister Maria, who is the HOD of Anatomy at University of Lahore. I've got a few lovely guests from Lahore. As we go, you'll come to know them and we'll introduce them. Thank you so much for being here today. My international speakers, my local students. Special thanks to my students and organizing committee. And in the organizing committee, my profoundest thanks to Soha. Soha, Allah bless all of you. Allah bless you, Saima, Madhu, Fatma, Ravesh, the whole team, and especially my daughter Uswa. Masuma, if I am forgetting somebody, please do forgive me. Fatma, thank you.
Ladies and gentlemen, it is my honor to welcome a distinguished leader in South African healthcare, a woman whose career spans over 30 years of dedicated service in clinical practice, healthcare leadership, and medical advocacy, Dr. Angelique Acoetzee.
I want to congratulate Dr. Salma and her team, including her husband, for having this international conference on medical research 2025. My theme, bridging gaps, building futures. When we build these bridges, we don't just close gaps. We open futures. not only for ourselves, but for our communities that we are serving. Just want to, again, in the interest of time, one of the most vital bridges we must strengthen is the bridge between practice, research, and education. Too often these operate in silos. So clinicians treat patients, but they have not access to the latest research. Or researchers publish findings that never reach the bedside, as I've already said. Educators teach from outdated curricula, leaving our graduates unprepared for the modern realities that's out there. When these three streams flow together, they form a powerful current for progress, and that is what we want. We want progress. So at the heart of this conference is the idea of integration. Clinical practice, listen carefully, clinical practice cannot stand alone. It must be informed by evidence. Research cannot remain in academic journals. It must find a way to the bedside. And education cannot simply be about the transfer of facts. It must inspire critical thinking, innovation, and compassion. And I think this is what this university is also standing for. So when we integrate our research, our practice, and education, we will then start to create a cycle of continuous improvement that benefits both the clinicians and the patients. So we have to do that. We don't have a choice. I also want to say, by bridging the bridge of integration and bringing your practice, research, and education together, we ensure that the patient benefits from the latest evidence, the researchers stay relevant, and students graduate ready to lead. Few words on technology as a bridge. We know this is one of the most powerful bridges we can build, is through technology. We know about e-prescribing, digital pharmacy integration, electronic health records. We should stop cutting down the trees. We need to start to move over to electronic health records that create continuity. It's data-driven decision making. We need to look at artificial intelligence and machine learning, because those can predict disease progression and also enhance our diagnostics. So if you look at machine learning, I need to say it is now being applied across diagnostics, predictive modeling, and treatment pathways. There's beautiful programs out there, and I think our colleague is going to maybe address us on this. So we need I need to leave you with one of the quotes. So data will not replace physicians. Listen, data will not replace physicians, but physicians who use data will replace those who do not. And let us be clear, technology is not here to replace the clinician. It can never. It is here to improve the clinician. I very often remind my colleagues when I say to them, the future of healthcare is not about replacing doctors with technology, but about empowering doctors through technology. We need to understand this. No machine is going to replace you, but if you don't work together with your AI companion, you will be outdated. Someone will take you over. So, and this will be happening with what we call virtual clinical partners. And again, these AI-enabled virtual clinical partners is a tool. You hear me? It's a tool. It acts as a second pair of eyes. It's supporting the physicians in diagnosis, risk assessment, and predictive modeling. So, or AI-enabled virtual partners, that's what we need to call them, are emerging to support clinicians in real time, because that's where one of our problems is lying. It's the real time. What do we do in real time? How do we manage in real time? So I just also want to stress this. Well, healthcare can be more proactive than reactive, but with all these systems that we do have, it comes with responsibility. You hear me? Responsibility. You've got a responsibility to protect the patient data, to ensure equity of access, to train our workforce to embrace technology rather than fear it. So there is responsibilities from the training institutions as well. And before we finish, the human element. While we celebrate innovation, we love innovation, we must never forget that medicine is and always will be a deeply human endeavor. Patients do not just seek cures, they seek compassion, they seek dignity, they want to be understood. That is a fundamental basic human nurturing element that we all have. So bridging our gaps is not about only science and technology. It is about listening. So I want the youngsters to listen. It is about listening. It's about teaching and serving. It is all about ensuring that no community and no patient is left behind. And only you and we can do it if we take hands together. So the future of healthcare will not be built by doctors alone, nor by researchers alone, nor by educators alone. It will be built by all of us sitting here today. Doesn't matter, it's across disciplines, it's across borders, it's across generations. And this is why the gatherings like this ICMR 2025 are so vital. This reminds us that knowledge knows no boundaries and that collaboration is the key to progress. So, on my closing thoughts, I leave you with two reflections that capture the spirit of this conference for me. W.B. Yeats once said, "Education is not the filling of a pail, but the lighting of a fire." And Nelson Mandela reminded us, education is the most powerful weapon which you can use to change the world. So when we build bridges, we don't just connect islands, we connect futures. Ladies and gentlemen, let us light that fire. Let us build those bridges together. Let us commit ourselves to create a future where healthcare is safer, smarter, and more compassionate for all. Thank you.
Thank you for sharing such valuable insights with us. Now let us introduce our second speaker. It is truly an honor to introduce a highly respected leader in preventive medicine, public health, and academic research, Professor Dr. Saira Afzal, Dean of Public Health and Preventive Medicine and Chairperson at King Edward Medical University, Lahore. With over 13 years of academic leadership and more than 7 years as Dean, she has made significant contributions to the advancement of community medicine and health systems research. She holds an MBBS, FCPS, and a PhD in public health and community medicine, all earned from the very institution she now leads, as well as fellowship in medicine from the College of Physicians and Surgeons. Her work is widely published and recognized for its real-world impact. Today, she brings us critical insights into one of the most pressing healthcare challenges of our time. Her keynote title, Evaluation of AI-based Radiological Diagnosis of Tuberculosis, Sensitivity, Specificity, and Comparative Advantage over Sputum Culture in Lahore, Pakistan. I would like to call Professor Dr. Saira Afzal to share her insights. Thank you.
Thank you very much. Assalamu alaikum from Lahore. Today I am very excited to be your guest here, but at the same time I am sad too, because our communities, they are in floods, and I request everyone who is sitting here to please pray for the safe journey. And I am very much glad that Dr. Salma Aslam Kundi, who is an amazing person, a powerful woman, and a strength for every woman who is sitting not only in this hall but also in Pakistan, because I have seen her Every Sunday, she is attending the webinar when every other person is enjoying a deep sleep in order to come out of the fatigue of the whole week. She still make it that every Sunday she is sharing her knowledge, her skills and wisdom. And this is how I got connected with Dr. Mubashar, who is versed in IT and also in artificial intelligence. Being a member of Pakistan Medical and Dental Council myself, and in HEC Journal and Research Committee, as well as in National Bioethics Committee of Pakistan, and also in Royal College Bioethics Committee, I will give you one important message, that Pakistan is doing a lot of research. There is a lot of data that is available because we are a populous country. Even in Punjab, Delhi, at Institute of Public Health, we have more than 124 million people who are giving their data for dengue surveillance, for the surveillance of infectious diseases. But whenever you see the landscape, you will not see Pakistan being one of a very good country in research. What is the reason? Because we don't have lots of conferences, we are not using artificial intelligence IT, we are not making our journals visible on OJS so that the rest of the world, they get to know that we are not far behind our neighboring countries. Even in a country that is neighbor to you, you can see how much PhD they are producing, how much research they are producing. It is all visible. And we are doing many things. We are even in the Stanford list of top 3% scientists, but still our research is not visible. So my message to everyone here is, please do research and also use artificial intelligence tools as well as IT tools in order to get your visibility. Otherwise it would be wasted. Just like floods, we are wasting water. We are not making a use of it. So we will make our research useless if it is not visible. So with these words, I belong to King Edward Medical University, very rightly said, because I am the alumni of King Edward. I am also the fellow of Royal College of Physicians and Surgeons, Glasgow. But my pride is I am also the Dean of Institute of Public Health, one of 126 years old institution. The only institution in this area that was making the vaccines before Pakistan came into being and supplying it to all of the subcontinent, even to Bangladesh. And when Pakistan came into being, this institution is the main center for eradication of smallpox. And we are very proud of this fact that when COVID hits us, Dr. Julia, as you have said about Omicron, only one institution was capable in whole of the Punjab to do all the COVID tests within 24 hours. And that institution is Institute of Public Health, and we are proud of this fact. This is the evolution of IPH. You can see in 1964, the building, it is newly renovated in 2025. So it is the government from 1964 to 2025, we have now the Artificial Intelligence Lab. So in 1898, it was established as the Punjab Vaccine Institute under the British India. In 1948, it was renamed as College of Hygiene and Preventive Medicine. In 1960, the new building was completed, and today we are housed in 88 canal area, and we have 12 buildings. One of the building is dedicated for HIV, one of the buildings dedicated for artificial intelligence, one of the buildings is dedicated for mother and child health. Dr. Rabia is here, who is the head of mother and child health. Similarly, one of the buildings dedicated for public health dentistry and quality enhancement cell. Similarly, we have lots of buildings with one important mission, that we have to save lives. Similarly, in 1995, it became the Institute of Public Health, and till now, in 2025, we continue to operate as the Institute of Public Health. And I'm so thankful to Dr. Salma that when she is telling about the Institute of Public Health, she said College of Community Medicine. Yes, we have been the College of Community Medicine, and now the same institution is working as Institute of Public Health. Our key programs are Staff College. We are very proud of this fact that it is the only staff college in whole of the Punjab to train the administrators in Punjab to give better services in all the hospitals. We have Mother Center, we have Preventive Pediatric Center, we have Autism Clinic, we have the Community Medicine Department, we have Telemedicine, and with the help of Dr. Mubashar, soon our Disease Surveillance Center would become the global partner in having surveillance of all the diseases, not only the infectious diseases, but also the non-communicable diseases. We have Scotland Public Health Collaboration, and we have the Lifestyle Medicine Center. Again, we have the state-of-art facilities. We have the Cognitive Behavioral Therapy Center. We have a very strong alumni association. More than 2,000 people, they annually come to Institute of Public Health, and I'm very proud of this fact that Dr. Hina, who is the head of Department of Community Medicine at another university, she is the proud alumnus of Institute of Public Health. Similarly, we have a Noor-e-Nazar project where we are distributing the glasses to the school children. Our school children, they are getting punishments because they were not being taught, because they can't see the blackboard, they can't see the whiteboard. And the teacher says that they are not able to perform well in exam and they have to repeat the class again and again. We saved the years of those children. And we have also saved the sights of those children. The actual reason was because they can't see properly, and that's why they can't learn properly. So we have the Noor-e-Nazar project, we have research and outreach services, especially for the flood affected areas, for the water surveillance activities, for the certification courses, for the family health filter clinic. Our Journal of Health is the oldest journal of Pakistan. I repeat, it is the oldest journal of Pakistan that was established in 1951, and it is the only journal that is present in the Wellcome Trust Library in UK as well as in New York Library. So this is in glance what we do. We have lots of postgraduate programs including masters, FCPS, MCPS, and in this year 2025 we are announcing our PhD program too. Similarly, we have our masters in lab technology in whole of Punjab as well as the big labs like Aga Khan, etc. They all are having our students of MLT, they are working there. We are having the community services, we are giving technical assistance to the government of Punjab. The dengue SOPs, the malaria SOPs, all the infectious disease SOPs, the tuberculosis SOPs, they guidelines, these all guidelines are developed at Institute of Public Health. We have community services, we have dental services, we have labs. It is the only public health lab in whole of the Punjab that is doing not only the test for COVID, but also for HIV and all the infectious diseases, because we have the BSL-3 lab. And I know most of you know that it is very difficult to develop a BSL-3 lab in settings, but we have this lab. So this is today's topic, that how we are combating tuberculosis. You know, Pakistan was at 7th number of tuberculosis, but recently we have jumped up to 5th number. So we decided that we have to do something for it. Otherwise, if we continue to progress like this, Allah na kare, God forbid, we would be the number 1 in tuberculosis. So we engaged our artificial intelligence team and we developed softwares, and I would show you how the sensitivity and specificity of diagnostic facilities that were improved not only in the community but also in the clinical settings. So we evaluate the AI-based radiological diagnosis of tuberculosis, and we did. Tuberculosis, you know, is a global infectious killer, particularly in Pakistan because it is a high burden country, and the innovative detection method was needed. So we did AI interpretation of chest X-rays, and we validate it against the sputum examination on microscopy as well as cultures, because that is the gold standard. And multiple evaluation shows artificial intelligence chest X-ray system achieve high diagnostic accuracy comparable to expert radiologists, and the feasibility is it is deployed through the mobile phones. I know everyone has a smartphone. So we deployed the smartphone for having the community to be reached and their X-rays to be done, and then the whole data is presented on the smartphones. But the microscopy facilities can't be taken from one door to another door. But this technology can be taken from one door to another door. So these are the objectives of our study. You would be interested in knowing our population. So our inclusion criteria was that age was more than 15 years, there were respiratory symptoms, they are willing to undergo chest x-ray in the vehicle that has the miniature chest x-ray provision, and we provide them with the consent, and we obtain the written consent too. So we have to give the whole information before taking any of the sputum sample as well as their chest x-ray. And we have excluded all those who are already on anti-TB medicine. We have to exclude the pregnant ladies, but in next stage, yes, we are going to include them too, because we have the shield for the abdomen and we will include them in the second phase. Similarly, we have the diagnostic facilities, including the index test. We have the artificial intelligence system for posterior interior digital chest radiograph analyzed by a WHO recommended computer assisted detection product that is called Lunate Insight Chest X-ray QXR CAD4 TB at pro specified thresholds, and we compare it with sputum, not only with the sputum microscopy and culture, but we also have the gene expert deployed for it. And then we have this sample size. We have more than 12,000 to 14,000 participants, and we have entered into second phase, where again we would have 1,400 people to be included in this, until we would reach the 10th phase, where we would have complete 14,000 samples. Today I am presenting the results of 1,400 people who have been positive. So this is the sensitivity and specificity results, and you would be glad to know that when we compared with the gold standard, our CAD chest X-ray had 0.993, that means 99% sensitivity and 99% specificity. When we pooled the results only for the chest X-ray, at the confidence interval from 87 to 96 or 0.87 to 0.96, you can see a very narrow range. We have 93% sensitivity and 94% specificity. Similarly, in our clinical studies where the patients are admitted in the hospital, we deployed the same technology and have seen again 99% sensitivity and 99% specificity, with the pooled results of 91% and the specificity about 65%, because our hospital patients, they are having comorbid conditions. So the validation and accuracy is amazing, our reduced expert volume, and we have these timelines when we did it. In first and second month, we have the ethical permissions, we have the site preparation, we have the site visits, we have the training, and we deployed more than 2,000 dengue workers, community workers, field supervisors, and we trained them. Then we did this pilot study that I am presenting today. Then we have the enrollment of our community as well as 3 attached hospitals with the Institute of Public Health. We have highly contagious, high density units where we want to quarantine our patients who have miliary tuberculosis. Similarly, we did the analysis and drafting, and then we disseminate these findings not only here but also with the Punjab government. AI-powered chest X-ray screening demonstrates diagnostic accuracy comparable to gold standard. So why to go for a high-tech equipment like Gene Expert, Culture, BACTEC? And we can offer this solution for tuberculosis control, not only in Punjab, but in other high-burden settings. So this is my presentation of today, and I would end with the very important concluding message that we are doing all these testing through the grants of Punjab government, through our collaborative partners. And another very important thing that we are doing, again, that would save life, that would prevent disease, that would prolong life, is the water testing. I was amazed in the morning. One of the company has put a label that is showing ranges. In Institute of Public Health, we are doing another topic with the help of the Punjab government, where we did the water testing from different sources. We check for lead, we check for arsenic, we check for antimicrobial resistance, we check for typhoid, cholera, and many other diseases, including hepatitis A and E. And we found very sad results. Most of the companies that are having the labels, it is incorrect. So I would beg everyone who is here, please check the labels before drinking anything, because your health is very important. It is in your hands. Don't believe whatever is there. Check it with evidence. Data is here, but we have to read it. If we are not reading it, this data is useless. So thank you very much once again, and I say thank you to everyone, especially my hosts. They are wonderful hosts, the girls who are standing and saying Bakhair Galle. Thank you very much, everyone.
Thank you for sharing your valuable insights with us. Respected audience, please join me in welcoming a visionary in healthcare innovation and digital transformation, Dr. Muhammad Mubashar Iftikhar, currently leading medical tourism and healthcare innovation at MedAsk, Pakistan. Dr. Mubashir brings over 2 decades of experience across clinical practice, healthcare IT, and international medical travel. He was a founding member of the Malaysia Health Travel Council and held senior roles at KPJ Healthcare in Malaysia, where he drove strategic growth in medical tourism. As Chief Information Officer and later Head of Digital Transformation, he led Malaysia's first private healthcare cloud, achieved full EMR adoption, and introduced cutting-edge technologies like IBM Watson for oncology and Pepper Robot, reshaping the patient's experience. Today, he will share insights on the transformative potential of artificial intelligence in clinical setting. His keynote, The Role of AI in Clinical Decision Making. Please welcome Dr. Muhammad Mubashar Iftikhar.
Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning. Thank you so much, the organizers, for inviting me for this wonderful session on research and innovation with probably artificial intelligence as the base topic, as everyone has touched upon, and probably we are at an inclination point where we have to be all at least know, if not use, then probably start using and practicing through the use of AI. All my life I've been doing balancing act, so I'm now doing another balancing act while standing at a very small piece of wood, I think. So I am a medical doctor, graduated from PMC, then 2000 I went to Malaysia. In 2007 I left my masters in surgery to adopt IT. 2011 I became the Chief Information Officer for the largest private healthcare company in Malaysia. But 2008 I was part of the Prime Minister's team to develop Malaysia Healthcare Travel Council, which is for bringing overseas patients, which I'm now trying to establish it in Pakistan, a role given by Pakistan Army to establish this. So then continued my journey in IT for quite many years till now. This morning I had a meeting with the head of health Oracle from US discussing some of the Southeast Asian innovations which they want to adopt, and I'll probably touch that as well in my presentation. I tried my level best to keep it short and succinct and within the time. So the AI Copilot augmenting, what we are trying to say here is that we are in the world of technologies for year 2000. In year 2000, there was a phenomena called productivity paradox. I suggest all of you to probably look into what is productivity paradox. With that, we basically became part of the IT. And we say this is the age we call second robotic age or second cognitive age of IT, where we say that probably AI will take over, and we may not act as doctors or whatever profession we have, and it will be very difficult for us to remain what we want or remain what we want to do. But the core idea here is, and I still believe, and like for last 15 years I've been telling this, that doctors will still have edge, and madam rightly suggested that the doctors who use IT, they will probably continue working than those who may not use it or who will not use it. This American company called HoloSense, I think, this company has developed a holographic room, a small room where these rooms can be transported or can be incorporated into the buildings, where doctors can come sit in the room, and on the other side, as in the image, a doctor is talking to a patient. So this patient, the doctor basically in a 3D image is just like as if the doctor is sitting in front of you and talking with the patient. So this is, it's not really an AI as such, but things like this, when we think of the data and the technologies, are transforming the industry. The clinical decision bottlenecks, when we see that the huge amount of data, lab results, scans, EHR or EMR data, which is like unstructured images, videos and all those, with the patient histories and other things, with the clinical decisions, then some issues with it, all those bottlenecks are basically come to one single, where we make a lot of mistakes. How we can reduce those mistakes or make better decisions, that's something which we have to basically learn and adopt through the technology. The AI and the co-pilot. Today, if you like browse using Microsoft Edge is a browser, you will see that on the one side it has a co-pilot in it, which is your browser co-pilot. Similarly, today we are thinking that how these co-pilots can help different decisions. I'll touch upon this in a little more detail, but this is how the healthcare is getting transformed, that we are being helped by co-pilots. Like sometimes we take the help of a browser or maybe ChatGPT. I'm sure all of you must have used by now a large language model, but there are many of those, like now, small and big, which are, some are available in the cloud model, some are offline. So all these models, they are just like a co-pilot, giving you sense of information from the data which you share with it. They provide you, or from the pool of information or data which they have housed in it, and they suggest some degree of idea, some understanding through that. So similarly, these co-pilots in healthcare are becoming very important, and they are providing a lot of help in making decisions and reducing error. Madam Saira touched upon the radiology aspect of it exactly. So we see, if like in Mount Sinai, it's like 10 years old predicament, that they were having a lot of errors in their reports, in the radiology reports at the Mount Sinai, and they adopted a cloud model by then, and a little bit of, those were the logic based, not the AI based systems, and they came to understand that it is a huge difference. In 2018, like almost 7-8 years, Google did a study in India for ophthalmology related diabetic retinopathy, and they were seeing whether the doctor can detect it with the eyes or the AI machine can detect with the digital the machine. I don't remember the exact apparatus used. So it was quite amazing by 2018 that AI can make much better decisions than the very experienced ophthalmologists looking into diabetic retinopathy. So these machines are sensing these errors. Similarly, we come to digital pathology. You will be surprised that the error rate in detecting slides or understanding, reading, giving ideas, or maybe those nuances which are related to pathology in slide detecting or reading are tremendously reduced using digital systems. You talk of like any room, may it be a patient room or OR is much important, or maybe an ICU bed. So these days there are many technologies used to sense and produce data. Data is now at like a humongous speed. By 2023, it was supposed that the data in 20 days will double. Imagine the data in the whole world. And in Pakistan, how much of a data we are producing? We are not producing much of data. When the internet evolved by year 2010, it was suggested that the 10% of the internet data is healthcare data. How much of Pakistan's developed that data? I was recently in Karachi, discussed with some of the doctors, even in like big hospitals, say Indus Healthcare, they have amazing healthcare system. Their doctors are even not writing the clinical notes through technology. They are still writing with the hands, and those are then either saved as PDF images and transported through EHR for fast recovery and diagnosis and helping patients. Similarly in Akhan, same issue everywhere almost. So we as a nation, as a community of doctors, have to take these decisions that we have to build on it. So you see how these innovations are changing the world. We talk of EHR, electronic health record. Every aspect of health record today, when we say if it is text, machine can very well understand and can give. Like a year 2010, when I started my work at the KPG Healthcare, we had the issue that the adoption rate of the EHR was very low. We told the doctors that why you need to use EHR, electronic health record, is because the error of prescribing medicine reduces. Only one single aspect, the error. So when the doctor prescribes a medicine, the system at the back understand that this patient is 70 years old, male, he has comorbidities, how this comorbidities can affect that prescription of 5 new drugs or 2 new drugs. Only a prompt at the screen will tell them that this is the prompt, probably there is a drug to drug interaction or age to drug issue or something like that, please check it. That prompt was very important for doctors to like reconsider their decision of giving this medicine. Just one simple act started doctors using it. We as like tech IT guys, or we as management team, told the doctors, no, you have to use, because we know you only know 20, 30, 50 drugs at maximum. We have 10,000 drugs in the world. Maybe some other doctor has prescribed some drug which is in the system, and you are giving another drug and you don't know much about that particular drug. How do you prevent the risk? That is, so in today's AI time, these are like 10 times, 50 times the nuances which come, the understanding, the results, the goals which we can achieve through adoption EMR and transforming it to different ways. AI in oncology has done, like I was at the launch of the artificial intelligence new phase of Watson by IBM in 2016 at the Esther building, their headquarters. You will be amazed, just 30 words of history. The machine, by that was 2016 machine itself could suggest that after this 30 words of history, what next I want to know. We feed it the system with the Gleason score, only 6 areas. Machine said no, this prostatic biopsy for carcinoma is insufficient, and he was a specialist doctor. He said no, I can score, classify tumor and start the medicine. IBM Watson machine said sorry, this is incorrect, you cannot give this drug based on this Gleason score of 6, you have to take at least 10 portions, 10 different areas of prostate, things like that. You see, you will be amazed that people use in Malaysia, even in Western world, up to date to come up what is the latest drug for a cancer. To understand that particular drug, a doctor in KPG Healthcare, where I worked as a CIO and CDO for almost 9 years, they used to tell me it will take them at least 1 week for a patient to read material, and in between they may make mistakes not reading what is required. IBM Watson in oncology was doing that at a whisk, like you just tell. It was suggesting that this particular patient, after having all these, and IBM Watson could read CTs, MRIs, ultrasounds, X-rays on its own without doctor. It did not need reports. So you'll be amazed that the drug system will suggest that this will have these side effects. If patients say no, omit because I don't want to lose my hair, then the machine will suggest probably this, but it will have a longer duration of use, less efficacy, probably it may, like the cancer may remit or things like that. So you imagine with that data, endless possibilities. So like my journey, I worked at KPJ Healthcare for 8.5 years. Then I started working with the universities in Malaysia. I developed e-portfolio, and my system was used by the Masters of Cardiology in 2020. Started first Masters in Cardiology in Malaysia for cardiothoracic surgery by UITM. Then the same, because of the same system used and how I had designed it, it was the Ministry of Health called for a meeting. Then 4 universities were clubbed into one master's program based on the system. They said we do not need 4 universities to come here, get certificate from us and do the master's program. You all should do one master's program because you have this wonderful system. We can get all the detail from it and we know what level of students we are producing. So, and then I came here a lot of so the human loop in AI. So today we are at like crossroads, whether we use AI or not, but it is in our hand. As I earlier said, the doctors who use it, they will probably have better say rather than the doctors who don't use it. AI in like so many senses, the data coming from different, say, patients' prescription, patients' habits of different eating habits. When we feed this, it all generates sense, and this sense can help make decisions better. If we have patients' routine, we say loop of health. We cannot bridge or complete the loop until unless we understand what patient is doing at his house. So like my time, again, ethical considerations are very important. We must understand, we must know what we are looking at. 90% of adoption of technology is preparation. Only 10% is technology. Do not think you buy the technology, you can champion it. You have to know how to adopt the technology. What are the nuances are, like how you start with it, basics, how you train your staff, and what are the issues with it. So understanding the iceberg is at the below, like 85%. So I say 90% as well. So 90% of it is more of planning, understanding, only 10% is technology adoption. So the future is in our hand. We know we have very powerful gadget. The same iPhone 4, just let me build an analogy. iPhone 4 in year 2005, the supercomputer in Japan was 25 million US dollars. Same iPhone 4. Today you carry maybe iPhones 15, 16 Pro. So these are very powerful gadgets. You just need to learn, adopt, and transform. Similarly, the patient. So I think this is the Oracle Health. I had the morning meeting with the Oracle. So they actually said now they do not want the text data. They want voice. When people are talking, doctor-patient communication becomes part of the EHR system. Understands itself. It says this is like not required. This is part of this. Everything is captured. Agentic models. You be amazed that agents in AI are transforming. You have, say, you are a researcher. You have to build some research based on you can model that, and it will only do that part. It will be like your co-pilot, work with you, along with you, to help you understand or make a decision, or maybe take the next step. So similar thing. Thank you so much.
Ladies and gentlemen, our next distinguished speaker. Our distinguished speaker is Professor Dr. Ejaz Hassan Khan, currently serving as the Vice Chancellor of Gandhara University, Peshawar. He is also a highly respected professor of chemical pathology at the same institution. He holds multiple qualifications including MBBS, MPhil, PhD, FRCP, FCPS, FCPP, Diploma in Professional Faculty Medical Education, and MHPE. Among his many professional achievements, he has served as an executive member of the Pakistan Society of Chemical Pathologists and is a life member of both the Pakistan Association of Pathologists and Pakistan Society of Chemical Pathologists. He has been a resource person for the National Accreditation Program for Laboratory Medicine with the Pakistan National Accreditation Council, Islamabad, and is a certified assessor for ISO 17025 by both the United Nations Industrial Development Organization and the Norwegian Accreditation Council, as well as by PNAC Islamabad. With such an illustrious career dedicated to education, research, and professional excellence, we are privileged to welcome him today. He will be speaking on a very significant topic, strengthening healthcare through academic and clinical partnership. Please give a warm welcome, round of applause to Professor Dr. Ejaz Hassan Khan.
Bismillah ar-Rahman ar-Rahim. As-salatu wa-salam ala khatimul nabiyyin, fakhrul awwaleen wal akhirin, rahmatal lil alameen. Honorable Chief Guest, Professor Johar Sahib. When I was President Khyber Medical College Teacher Association, he was President Peshawar University Teachers Association. So still his name saved with me in my phone is Mr. President. Honorable keynote speakers and especially our guest from South Africa, Dr. Angelique, a very dynamic leader in academia and especially taking this institution to a very high position, Professor Salma Kundi. It is because of her leadership that this institution is winning first position in quality assurance among the 18 to 20 medical dental colleges of the province. Her husband and a born leader, Dr. Azhar Jadoon, ex-member of National Assembly, guests, faculty members, and my dear students, Assalamu alaikum. This topic has always remained very close to my heart. Though I don't consider myself to be an authority on this because public health experts are here, but still, lahu laga ke shaheedon mein naam paida kar. There are a lot of challenges in healthcare system. Some persistent public health challenges, then problem in the fragmented healthcare system, but the power of partnership, especially the academia and the clinical settings, that can bring about change which is required and expected. Our national poet Allama Iqbal said, Sabat ek tagayyur ko hai zamane mein. Only change is constant. Sabat ek tagayyur ko hai zamane mein. Infectious diseases. You know about all the other diseases, but especially I'll tell you about my personal experience in HIV. I started my career in pathology in 1991. From 1991 till 2019, almost 30 years, I saw in my practice, not from the provincial data, I have not touched that, 16 cases of HIV. But after that, till today, every month I see 5 to 6 cases. So I think it's a growing problem and the public health expert must be aware of this. Then we have very limited resources. The infrastructure is not good. There is a lack of awareness because prevention is better than cure. Preventive programs, I think they are not taken in that stature or stage which is required. So I need to request the public health experts to kindly work on that, because that is our problem. Maternal child health, malnutrition, but non-communicable diseases, they are a little bit overshadowed. But I think that diabetes, in 2010 I read an article in which was written that in 2025 Pakistan will be the leading country with diabetes, and today that has happened. Environmental hazards, especially in the current flood, after this, so a lot of diseases will spread. So I think we are not, I don't know, but the public health experts should tell us that we have worked on that, or not. Then we are spending less on our health sector. Disparities in urban and rural population. The facilities available in both are having a lot of gaps. Then shortage of healthcare professional, but this is a little bit debatable. Personally, I believe everybody wants to remain in the city. Nobody wants to go to the remote areas. So I think the government must do something about it. Still there are lack of health professionals. Economic barriers, because economy is the strength of this institution. Got this position because the principle was facilitated. That's why it has reached a very top position in the province. So economic facilitation, this is, I think, the basis of every positive activity. We all know that our healthcare system is fragmented. I'll try to be quick because I can see the people, they are tired. So, lack of political commitment is mostly in our country. It's a problem. Though some people come and they do a good job, as health card was a very good initiative, but even that has also been sort of misused in certain places. Our education system, it is fragmented. We don't say that it can be uniform. Nowhere it can be uniform, but still there is a lot of fragmentation. What are the solutions? Finances, increased funding, curricular reforms. Though this country has developed a lot on this sector, especially we were having conventional system, but it has changed to integrated modular system, and the regulatory bodies like Pakistan Medical Dental Council, they also brought it in their rule that for promotion from assistant to associate or associate to professor, you must be certified in health, certificate in health education, CHPE. So that is also, I think, that has brought about positive changes in our academics. Public-private partnership. Though in our province this has started, but it was not properly followed. I think if it is monitored properly, because mostly the vested interests, they come in, and the real people who should be given these responsibilities, they are left. Community engagement, again, public health experts are, their job to communicate the masses, but educate the masses, but still they also need resources. So I hope this institution will inshallah take a lead in community awareness program for health. Now Pakistan continues to face a lot of health challenges, especially life expectancy is less, high mortality. Then the most important is significant years lived with disability. that is also a big issue. So there is urgent need for rectification of these things. Now this slide will require an hour to be explained, but this has shown certain the diseases and geographical distribution, as well as with life expectancy in years. This is a very interesting slide. If you look at the breast cancer in women, so it is almost nearing the global problem, and slightly it is increasing over the years. But the lips and oral cavity cancer in men, I think if you see, so it is really alarming. And I think maybe this is due to poor hygiene, pan frequently used, or naswar, or anything, you name it. But there are some issues which are contributing to this highly increased incidence. What are the current gaps in the healthcare system? That is high years lived with disability and non-communicable diseases burden in low and middle income countries. Low and middle income countries, they face a disproportionately high and growing burden of non-communicable diseases, which are now leading causes of death, contributing to high years lived with disability. Now, what is the conceptual framework? WHO has given a framework, and the need to strengthen health system based on the principles of primary health care has become one of the most urgent challenges for policymakers, health workers around the world. Then interprofessional education as well as collaborative practices. They can develop a collaborative healthcare force which can have optimal health, can give optimal health services. Explanation and discussions are supported by example taken from 19 institutions in North America, Europe, Africa, Asia, and Australia. I was looking at data. Rwanda was a conflict-stricken and civil war country, but after 2001 or 2, I believe, they have developed their institutions. Experts from America, they are coming to Rwanda, and those institutions are flourishing. So I think collaborative efforts always they play a positive role. Then there are so much mechanism which shape the collaboration. That is institutional support mechanism, which are given in the slide, as well as working culture mechanisms, environmental mechanism, and if they are properly applied, it will result in optimal health services. Academic institutions, research capacity and data generation. In our country, though research is constantly going on, but now it is becoming structured. It is becoming structured. Teaching training infrastructure, though it was available at higher education in the NAHI, National Academy for Higher Education, but I think Pakistan Medical Dental Council and the universities, they have played a positive role, medical universities, in this CHP and MHP program, which are training the teachers in line with integrated modular systems. Again, lack of funds and expertise, it is always required. And I gave you example of Rwanda. They are calling experts from America and other countries, and they have taken advantage of that. And Dr. Salma has also taken a lead by involving such medical professionals so that their expertise is utilized in this institution also. A good thing about Pakistan is that the doctor easily available to you. Though one of my relatives, he fell ill in France, and he was given time after 1 month, so he had to flew back to Pakistan to get himself treated. So, but we are lacking multidisciplinary practices. Multidisciplinary practices will play a positive role in our society. And then, I don't know if I am right or wrong, I think we must do more impact studies. Impact studies on immediate feedback on interventions. I don't know, I think I've seen few, but I think we lack these impact studies. Global examples are from though they are not perfect, are from veteran health system in USA, NHS Academic Health Sciences Center UK, and from European Union. But there are examples from Pakistan also. Aga Khan University Government Hospital, collaboration with Sikh government and AQU to form a working group on public health. NUST and Polyclinic Hospital, they also have a partnership. So I think these collaborative efforts are needed to bring a change. Domains of collaboration, as you all know, are joint research and publications, training programs. One of your professors is here, professor of dental education, I don't remember his name, Shahid Saab. So I was in one of a meeting along with government of KPK. He was also representing this institution, and there was something bad going to be decided in ignorance. So he spoke very well and saved that damage. So clinical and academic audits. Clinical and academic audits in true sense are required. Maybe not, maybe within the institution, but a third party audit. Guiding values and vision, you all know, is good governance, innovation and transformation, equity and proper approach, responsiveness, transparency and accountability. I think the most important among these is first initiative and then transparency and accountability. If there is no transparency and accountability, a good program like health card is always doubted. And then thematic pillars are health financing, health service delivery, human resource for health, health information system, governance. I think governance is the most important because the person on the top always matters. If he or she wish, there are changes. But if they are hurdled in Pakistan, there is red tapeism, bureaucratic red tapeism. Then, as the world is shrinking, we have global responsibilities. Now, what are benefits of partnership? Now, they go hand in hand. Academic gains, clinical gains. Clinical gains, academic gains. Same as research opportunities will result in improved care, enhanced teaching, faculty development, staff development, and global collaboration will result in evidence-based culture. The challenges here are institutional silos. Every institution don't allow another institution to come forward, or they learn from each other. Misaligned incentives, we always see in our system. Red tapeism of bureaucracy, because they don't understand. That's why private sector is flourishing in this country, and public sector is, as you all know. And so bureaucratic red tapeism is another problem. And in our country, the problem is that we start a program, but it is not sustainable. So sustainable budgeting, funding, this is very important. How to overcome these barriers? Shared governance, though it's very difficult, but still we hope that a day will come that there will be shared governance, people will learn from each other's experiences. memorandum of understanding will be signed between different institutions, which will result in capacity building and interdisciplinary communication. And the key indicators are publications, joint grants, evidence and clinical pathway, and patient satisfaction. Now, role of regulator is very important. Professor Azhar, my brother, he knows that I remained member of Pakistan Medical Dental Council 2 times, and I am also on the positions of certain bodies in universities as HEC representative, as well as I remained for 2 years member of DRAP. So if you go inside these institutions, then you learn that how ये कहते हैं हमें हमेशा वक्त का मसला रहा है, लेकिन चलो ख़त्म करते हैं थोड़ी देर में. What is vision for future? Seamless ecosystem integrating learning, care and innovation. अब टाइम नहीं है इसको एक्सप्लेन नहीं कर सकते. Locally driven, globally connected. Locally driven, globally connected is a very important sentence. Conclusion is that collaboration is the future of health system. Health system cannot thrive in silos. And I end with खुदा करे कि मेरी अर्ज़ पाक पर उतरे, खुदा करे कि मेरी अर्ज़ पाक पर उतरे, वो फस्ल गुल जैसे अंदेश है ख़ज़ान ना हो. थैंक यू.
Ladies and gentlemen, our next distinguished speaker is a pioneer in the field of medical journalism and PhD and Professor of Anatomy at the University College of Medicine and Dentistry, Professor Dr. Maria Hidayat. Her remarkable journey began with a certification in medical editing from UHS in 2020, followed by an advanced course in medical editing and journalism in 2021. She then pursued global recognition by completing a 1-year certification in effective writing for healthcare at Harvard Medical School, Boston, specializing in grant writing. Simultaneously, she earned a diploma in medical journalism from the James Lind Institute, Switzerland. Currently, she serves as the managing director of the Journal of UCMD, launched in 2022. Under her leadership, the journal achieved HEC recognition within its first year and was successfully indexed in the Directory of Open Access Journals, a milestone that highlights her editorial excellence. Please join me in welcoming Professor Dr. Maria Hidayat.
Not too long ago, robots lived only in fiction. How many of you remember the Star Trek, the Jetsons, the Knight Rider? At that time, they all seemed such playful fantasies of the future. And yet, here we are today, not only talking to them, but also trusting them with our clinical decisions. For me, this journey began in the dissection halls of the Ayub Medical College, where over the next 22 years, I built a career teaching anatomy, guiding students not only to learn structures, but to think, to question, and to explore. That same curiosity eventually led me to Harvard Medical School, where I trained in medical writing and editing. And today, as a founding editor of the Journal of University College of Medicine and Dentistry, I find myself at a unique crossroads where teaching, research, and publishing meet, while watching the rise of AI with both admiration and apprehension. And it is here that I must pause to ask you something provocative. What if your next clinical decision, your next research project, or even a life-saving trial were guided not by a human mind, but by a robot? What if the decision between life and death itself was no longer ours to make? Then what remains of our responsibility as doctors, as researchers, as humans? This is a very big question indeed for all of us. And it sets us thinking, where should trust lie? With AI or with us? The truth is, we don't have to imagine this future because we are already living it in the present. AI is predicting disease outcomes. AI is summarizing vast bodies of literature in seconds. And it is drafting literature and diagnostic tools beyond human recognition. Tools such as ChatGPT have even summarized vast bodies of literature in seconds, and that leaves us, and it's co-authoring research papers, and that leaves us with question of integrity. That is also sparking a global debate. But if these systems remain as a black box, and we are unable to find out how they actually function, can we truly place blind trust in them? Now that is another question that we have to ponder over. And that brings me to us, the editors. Our role has shifted. We are no longer the gatekeepers of methodology or simple grammar checkers. We are the ethical guardians of science. And it is for us to ensure that whatever is published is transparent and the use of AI is disclosed by the authors. And it is for us to train the peer reviewers in identifying biases driven by AI. And above all, it is our responsibility for safeguarding scientific knowledge, because if that is not safeguarded, the very credibility of science comes under challenge. But the question is that authorship itself is facing so many challenges, because if AI is drafting manuscripts, editing them, analyzing data tables, and even providing references, then who is the real author? The researcher? All right. Yeah. The researcher or the AI? If AI is generating text that appears original, then how do we safeguard against plagiarism? That is another burning question. And above all, if reviewers themselves are relying on AI for review, then can peer review truly remain fair? And yet, authorship is only the first red flag. The greater risk lies in safeguarding the very integrity of the research itself, so that a lemma moves beyond who writes. The real question is, how do we as editors ensure that research shaped by AI remains reliable, reproducible, and worthy of trust? The issue is not whether AI can help us or not, because it clearly can, and we all know that. The real question is, can we, as humans, keep control while it does? AI must support and not substitute human reasoning. It must be used transparently and declared openly. And final accountability must remain with us, the humans, because AI can assist the process, but it can never own the responsibility. If we look ahead, one thing is clear. AI's role in writing, peer review, and publishing will only continue to grow. But the real challenge is not in how powerful AI may become in the coming years. It lies in our responsibility as humans to define its boundaries. And the future of credible science will not be shaped by those who resist AI, but by those who embrace it wisely and responsibly, editors and researchers alike. So this brings me to my final slide of reflection. We need to reflect upon this. AI may help us write faster, analyze deeper, and discover sooner, but trust in science has never been built by machines. It is built by us humans through our ethics, our integrity, and our courage to remain accountable. As editors, clinicians, and researchers, the question is not, can AI do this? The real question is, should AI do this? And how do we keep it trustworthy? Because at the heart of every data set, every discovery, and every published paper lies one irreplaceable foundation, and that is human responsibility. And with that, I just want to share some of the images from my gallery. This was the day of my graduation from Harvard Medical School as a health writer. This is my editorial team celebrating the launch of the first issue of the Journal of UCMD, and that was back in 2022. This is the leadership of the University of Lahore, and you can see everyone smiling. The Vice Chancellor himself, I don't know how to point it, yeah, he's the Vice Chancellor, and there is a visible smile on his face. Let me mention here that we have 28 journals running from the platform of the University of Lahore, and out of those 28 journals, 2 are related to the domain of health, and both are recognized by PMDC, HEC, and CPSP. And the one here, the one you can see here is the journal that I'm currently running. And the other one is purely run by the Department of Medical Education at UCMD. This is our most elegant and graceful Professor Salma Kundi, who honors us with her presence, impactful presence, year after year at every medical education conference and research conference at the University of Lahore. It is an honor hosting her. And this is my wonderful daughter Hiba, who has accompanied me all the way from Lahore just to cheer me while I present this talk. Thank you so much.
Thank you for sharing your knowledge with us. With that, I mark the end of keynote speeches, and now we will head towards the panel discussion. The audience are requested to raise their hands in case of any questions. Dr. Khalid, come mic.
Assalamu alaikum. Dr. Ahmed Murtaz Khalid, Professor of Physiology, CMH Khariya Medical College. Thank you for enlightening remarks from all of you. Dr. Saira, Afzal, one pertinent question and a much needed debate, rightly so in the current scenario, because a lot of kids in school age, they suffer from amblyopia or lazy eye. And we need to adopt some strategies over there that at the time of admission in the school, there should be an obligatory screening test which can be done, or staff can be trained at the school so that they can identify at an earlier stage to avoid with one eye blindness later on. Your insight into that, I'm trying to implement that in my mother school in Khariya, but I hope that if we can raise that bar at national level, it might help a lot of kids. Thank you.
Thank you very much. This is a wonderful question, very close to my heart, because screening, it is one of the things that can prevent many things. I am sure all the medical students who are in the medical institution, you have been vaccinated with hepatitis B. Are you? How many of you? Just raise your hands. Okay, then go and have your first test of hepatitis B as well as C, and all of those who have not been vaccinated yet, please get vaccination. We must be vaccinated against, again, all the girls for HPV to prevent cervical cancer, and it is now available in Institute of Public Health from 15 September from free of cost, and we are going to develop the vaccine of HPV in Pakistan very soon. As far as the school children are concerned, they are malnourished, they are going to be blind. What type of nation we are? We have 44% stunted growth. It means those people who have been stunted in the past many years, now they are one of the policy makers. They are the parliamentarians, because it is not the 44% that is the last year. It has been there for the decades. In other words, वो जो हमारे बच्चे जिनकी पूरी IQ डेवलप नहीं हो सका, जिनकी फिजियोलॉजिकल ग्रोथ नहीं हो सकी, बिकॉज यू आर द प्रोफेसर ऑफ फिजियोलॉजी, एंड जिनके पूरी उनकी हाइट अचीव नहीं हो सकी, और वो पिछले 10 सालों 20 सालों से हम 40% से 44% में फ्लक्चुएट कर रहे हैं, आज वो बच्चे किधर हैं? My question is, where are those children? Now they are the policy makers, they are the parliamentarians, they are the professors, they are everyone. So why not to do something for our children? If we do it now, we will have a very strong nation, a very healthy nation, who will not be getting blind, who will not be stunted, who will not be malnourished, and it should be started while entering into schools, entering into medical colleges, and all the girls before getting married, they should be prevented from cancer. This is something that is very, very close to my heart. And for the medical students, आपके इर्द गिर्द आपके जितने class fellows बैठे हुए हैं, you would find them again and again in your beautiful memories, as I have found my class fellow. Professor is also my class fellow when I was in King Edward Medical College. Thank you very much for asking this question.
Honor is mine. Thank you.
I have just recognized you. Thank you very much.
Thank you, ma'am.
I am Dr. Khalid, Vice Principal, Women Medical College. Very good presentation on the tuberculosis in artificial intelligence. But my question is how artificial intelligence can help to prevent spread of TB in our country. For the last 79 years, we are trying to eliminate the tuberculosis, but still it is with us.
Yeah, I always say that tuberculosis is our national disease, because the founder of Pakistan, Qaeda Muhammad Ali Jinnah, he died of tuberculosis. And after Pakistan came into being, and today we are the nation that has jumped to the more and more higher position as far as prevalence of tuberculosis is concerned, because it is the system that is getting failed. We are producing lots of doctors, we are producing so many people, but we are lacking in producing allied health sciences professionals, good nursing care. We have already failed in producing BCG vaccination in our own country that is going to prevent tuberculosis. Tuberculosis has a very good treatment, but still we are dealing with multi-drug resistance tuberculosis, with extended drug resistance tuberculosis. If one of the contact is getting infected from the tuberculosis that is extended drug resistance, what is the sin of that person? It is actually the failure of the system that we have not only produced that strains of tuberculosis that are resistant to all the available first line drugs, we have increased the cost. So the prevention is the key, and the contact tracing, the artificial intelligence has a lot of role, because it is all dependent on data. Whenever you have one case of tuberculosis, as per epidemiologist, being one of myself, being a PhD in epidemiology, behind one case of tuberculosis you have 100 cases that are undiagnosed. That is called iceberg phenomena. So artificial intelligence can make the data very good for analysis. It can clean the data, and with the help of CAD, as I have said, we have saved the cost of testing each and every person through the gene expert. That is one machine that costs million of rupees. Similarly, Backtech, again one machine that costs million of rupees. We have decreased the cost, that is for culture. We can put all the data through chest x-ray, miniature chest x-ray. It is a small x-ray, just as you can have a chest x-ray through a mobile phone if there is the software in it, and that software can pick exactly where is the lesion in the apex of the lung and can give the whole tuberculosis diagnosis in the contact. If you trace the contact and stop the transmission of the disease, then the prevention can take place. And it would only help if we have the good artificial intelligence teams, we have more IT people, we have more people who can go into the cards and in the mobile units.
Excuse me, can we get the help of artificial intelligence to establish the new societies, new living standards, low socioeconomical groups, and the square area per living, the per person, the living area is for the persons. Agar we do it, so now we can, I think, prevent the tuberculosis to spread.
This is a beautiful question, because before the treatment of tuberculosis, हम जैसे लोग आपके पहाड़ों पे आ जाते थे और यहीं पर अपने मरीजों को भी रेफर करते थे और कायदे आजम को भी ज़ियारत इसीलिए भेजा गया था. लेकिन अब टीबी की दवाई बहुत अच्छी आ चुकी है, उस वक्त दवाई नहीं थी. सेकेंड, वैक्सीनेशन इज देयर. आई वुड सजेस्ट कि जितनी हाउसिंग स्कीम्स हैं, दे हैव देयर एसओपीज. लाहौर में लाहौर डेवलपमेंट अथॉरिटी है, इन कैपिटल वी हैव द कैपिटल डेवलपमेंट अथॉरिटी. आई नो इन ईच ऑफ द प्रोविंस देयर आर अथॉरिटीज who have to give the good housing schemes to the people, but it is the population explosion that our resources are limited. So with your suggestion, as you are saying, we can't move all the people to the sanatoria, to the hilly areas, to the very good environment. We have to do something at the place where the people are residing, and we can offer them BCG vaccine as well as the anti-tuberculous drug, especially when the disease has started through the contact tracing. This is my take in this. Thank you very much.
Excuse me, Professor Saira, can I ask a question?
Yes, yes, Dr. Samina. Yes.
Okay, my question is that can we offer this AI chatbot type thing that you have devised with the help of AI and the X-rays and compared it with the sputum and found it highly specific and highly sensitive, which is a great achievement. Can patients get an access on their smartphones if they take a picture of their X-ray and they can find out their diagnosis and the stage of and how good it is, how bad it is, so that they can be led to the doctors, because sometimes, many a times, they take a lot of time before they see the doctors. My connected question is about the vaccines, because your institute is the leader in the development of COVID vaccine. So can this polio be eradicated from Pakistan, and why it is not being eradicated so far? What are the challenges? And another connected question is that these days shingles vaccine, I have heard, is not available in Pakistan. So from where to get it? Thank you very much.
Thank you very much. So there are so many questions from Professor Samina. First, I appreciate your idea that every smartphone must have a software for tuberculosis diagnosis. That would be the future of AI in Pakistan that we all wish for. But today, if those people who are in TB program, prevention program, they are using CAD because it is a very costly software, and they are using in their smartphones to detect the miniature X-rays, and they are providing the services through the Mariam Nawaz clinics as well as mobile units in whole of Punjab. And we have done the pilot testing, and I have shown you the result, how good these results are. But the future is, yes, you are right. Everyone can detect their own chest X-ray through the software in their phones, and it would be freely available as ChatGPT is present in most of the phones, and most of the people have that in their homes. Second question about vaccination. So I first correct one thing. Institute of Public Health has been the developer of vaccine till the technology was from the Saira. There were cattle, horses, and the Saira was obtained, the lymph was obtained, and then it was distributed to all other areas, including Bangladesh, subcontinent, etc. But now the technology has shifted, and it is now the conjugate vaccines. The COVID vaccine, we have done all the testing. We have not produced the COVID vaccine. It was our donor agencies who have given the vaccine. We have administered it. We have given it to the people. Our next step is that HPV vaccine is coming through our donors, and it would be available free of cost. But we have that capability. If the government give us the green signal, we can develop this vaccine within few months, because it is not a rocket science. It is so easy to develop. But you know, the donor agencies don't allow to check the quality of vaccine. And we are here to promote it, that our vaccine is available. Anyone can check it. Any donor agency can check it. So what other transparency is required? The third question about shingles vaccine, yes, it is available. It is through the GSK, and one of a largest company who is making the vaccines is GSK, and it is available in Lahore. If you want further information, I can give you. Thank you very much for all your questions. I think I have satisfactory answers to everything.
I don't want to take too much time. One pertinent comment to Professor Dr. Angelique from South Africa. Thank you for resonating the voice of clear communication among doctors. That is prerequisite to avoid miscommunication, and a thorough message they can basically digest and then implement on the treatment plan. While listening to your South African accent, I want to just share with you Lionel Opie. I had an opportunity and honor to meet him in 2005 in International Society of Heart Research Council meeting in Toronto. You might know he is one of the fatherly figures in heart physiology and one of the renowned cardiologists in South Africa. And to bridge the gap, incorporate the multidisciplinary approach, where Dr. Maria has rightly mentioned the need of medical journalism. We need to emphasize through medical journalism that simply palatable information in local language should be available to reduce the weight, to follow the dietary plan, which is missing right now. We cannot find dietary plan for weight loss, for diabetics. Patient ko uski zaban mein, whenever you will not convey the message in their own language, it will be very difficult to implement, and they are very easily be hijacked by the quacks. So thank you for all your comments in bridging the gaps and improving or integrating the clinical practice with research.
Okay,
Thank you, ma'am.
thank you so much. We are getting very, very late. I only wanted to thank everybody on the panel and on the stage. And I only wanted to put in one word, all the great minds on the stage, after the lunch break, please get together. I only need 5 minutes of your time. Just jot down what the take-home message is. You please, Saira, tell us about the vaccination, at what age, at what time, or what we have to do and spread to the PMDC. So it's inculcated in our curriculum, and they make it mandatory that every medic should get the vaccines for hepatitis, as well as for the girls should get it for HPV. It's even recommended for boys, but girls are more susceptible. Thank you so very much.
Just one word. Thank you very much, everyone. But I want to especially thank my teacher, Professor Majid Chaudhary. He is here. He is the source of guidance and wisdom. And thank you very much, Dr. Salma, for bringing us here together. And Dr. Jadoon, because your powerful personality behind all the educational and research activities give us the hope that one day Pakistan would be able to make its first vaccine here, inshallah.
Assalamu alaikum, ladies and gentlemen. I'm Professor Majid Chaudhry from Lahore. I think we have to keep pace with the rest of the world talking about artificial intelligence. My friend Professor Faisal Ghani sitting here, he's the chief of surgery in Dow Medical University, and he said, why do we call it artificial? Why it should not be called alternate intelligence? Anyway, ladies and gentlemen, it's very well to go with the world. I'm these days looking after a cancer care hospital in the city of Lahore. You might have heard. We get patients from all over the world and the KPK and Afghanistan. You see, we haven't provided, pardon me saying that, education to our people. I think it's all false that 58% literacy rate. It's not. You go to the villages, they don't know about anything about their health. Yesterday I was reading a history book that the first mastectomy for cancer of breast was done in 1750 in France by Professor Heister. You might remember, if you remember your anatomy, there's a valve of Heister in cystic duct of the gallbladder. He described, 300 years ago. And he said that there is so much illiteracy around that I removed a cancer breast which was 12 pounds in weight. Ladies and gentlemen, would you believe 2 weeks ago I removed a cancer of breast which turned out to be 18.3 pounds. 350 years down the line, that's where we stand. We must talk of artificial intelligence, but I think at the very grassroots level, people know nothing about health. And I admit I have been a part of health system for the last 45 years, but I think we have failed to deliver health services to our people. Honestly, 350 years down the line, I removed a cancer breast which was twice as much as they did in 350 years ago. And it's a story day in and day out. I started my career in King Edward way back in 79 or 46 years ago. And I tell you, the pathology of cancer of breast hasn't changed this bit during the last 46 years. And unfortunately, I believe the way things are going in our country, it will remain the same over the next 46 years. It might sound pessimistic, but I tell you this is a reality. Thank you.
I would like to call upon a personality who is the founder of Vision of Female Medical Education in Hazara, ex-MNA of Pakistan and ex-president of PMA. He is now serving as a managing director of WMC, Dr. Azhar Khan Jadoon.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. I would first like to thank and welcome you all, and especially the people who have come outside from Abbottabad. The Most Honorable Vice Chancellor, Peshawar University, Johar Sahab, and we are so proud to have you here, because I think most of us senior people over here, we are graduates of Peshawar University, and it's an honor for us that you are here. Then, of course, Angelique, you have been an honor to us, and we have been really very, honored to have you in Abbottabad, then in the medical college, and then in our home. Dr. Saira, Dr. Mubashar, dear friend, Professor Dr. Ejaz, of course, my dear old friend, and I said the best word I can ever see in our lifetime. And of course, Chaudhry Sahab, Kamran, Iftikhar Qayyum, and Madam Faisal Ghani Sahab, of course, and Nasreen. So sorry, the Salma has written for me the name, so I couldn't go. Thank you all, ladies and gentlemen, and my dear students. Welcome you all over here, and thank you very much, Salma. You have been, my better half has done marvelous job by having this conference. As I would just take 1 minute, because Ejaz was talking about Naswar. Angelique, Naswar is like a chewing tobacco, very popular in our area, especially with the Pathans. So I was just day before yesterday, I was in that flood area where there were all Pathans. There were 43 deaths and a lot of damage to that area. So we were distributing money on one part of this thing with envelopes, and the other side was more, crowded. I said, what are they distributing? So that one of them told me they are distributing Naswar. So it was more popular than money. Thank you very much. Again, thank you very much, everybody. And hope to see you again and again in Abbottabad. And especially, thank you very much. It's a big occasion, and thank you very much.
Thank you, sir. Respected keynote speakers, once again on behalf of our organizing committee, I thank you all for sharing such valuable insights and inspiring perspectives. Now, as a token of appreciation, I would like to introduce our guest of honor for the opening ceremony, ladies and gentlemen, Professor Dr. Johar Ali, Vice Chancellor of University of Peshawar. With over 34 years of experience in teaching, research and administration, Dr. Johar Ali's impressive background includes notable positions such as Dean, Faculty of Social Sciences, University of Peshawar, ex-Vice Chancellor, Khushal Khan Khattak University, Karak, Acting Vice Chancellor, FATA University, Pro-Vice Chancellor, University of Peshawar, Vice Chancellor, University of Malakand, and Officiating Vice Chancellor, University of Sawat and Shahid Benazir Bhutto University. His academic achievements are equally impressive with a PhD and postdoctorate from the University of UK and MA with distinction gold medal. It is my great honor to now invite a distinguished guest of honor, Professor Dr. Johar Ali, to kindly come forward and present the shields to our keynote speakers. I would request our respected speakers to come and receive their shields upon their names. Dr. Angelique Acoetzee. Professor Dr. Saira Afzal. Dr. Muhammad Mubashar Iftikhar. Professor Dr. Ejaz Hassan Khan. Professor Dr. Maria Hidayat. Now I would request our principal, Professor Dr. Salma Aslam Kundi, to present shield as a token of gratitude to our guest of honor, Professor Dr. Johar Ali. Now I would like to request our guest of honor, Professor Dr. Johar Ali, to please come forward and share a few words with us.
Bismillah ar-Rahman ar-Rahim. I must have a few words for Dr. Salma, and I think neither me nor anybody else among you should be miser enough. And even Dr. Azhar Saab don't mind it if we appreciate her a bit more. Really, mostly we talk about women leadership. I mean, irrespective of this. And this was the first time I met her yesterday night. I wasn't expecting so much kind of leadership in the management skills. Really, I'm inspired. And normally there are so many organizations. Now I will try to introduce you to those organizations who often talk about women leadership skills. And luckily we got our students behind you. You have to learn these skills from Dr. Salma as well for your future. And Dr. Saab, first time for me to get into Women's Medical College. This is a pride for us and we are proud of it. And I wasn't expecting such kind of establishment, facilities available, the way it has been structured, and particularly when I got to the pharmacy department, believe me, marvelous. So, Dr. Salma, Dr. Azhar Jadoon, I got my friend on the stage, Dr. Ejaz Saab. We are definitely nostalgic, and at this time and age when we meet, we mostly talk about the past, isn't it? So I remember the days when we've been together in University of Peshawar, and really that is the place which we commonly talk about. And we are lucky enough that most of you have had your degree from Women Medical College. And this opportunity, really, it is a kind of opportunity which introduced me to those galaxy of intellectuals who studied from Women Medical College. I am proud all of you. On the stage, a very important, good speaker from South Africa, Angelique. And Saira, when you refer to infectious diseases, so I thought definitely we got so much in Pakistan and how many infection diseases there are. And when she referred to very important thing, that we are fifth, unluckily, in infectious disease, particularly tuberculosis, I thought to myself, we are the fifth populous country in the world as well. 2 years back, we were sixth after Brazil. Now at the moment we are fifth, and I was speaking somewhere in a conference, after 2-3 years, we might get to the fourth position in the most populous countries in the world as well. But you know, when I say something, inherently that conveys certain other meanings as well. Not necessarily the words when I use, they do not mean the same thing which are mostly understood by the people. Inherently, there are so many things which needs to be understood by you when I say this. Dr. Saab, really, you spoke much good about AI, which is the need of a time. And Dr. Sahiba, they are on the stage as well. Senior doctors here. Some of my friends, Dr. Hamidullah Sahib, Dr. Saab from pharmacy, and so many distant guests from other parts of Pakistan, and my dear students, Assalamu alaikum. Good time for me to interact with the doctors. I'm not a doctor, I've done only PhD, but definitely talking about at various occasions relating to different things, I'm just trying to share few things with you. And I'm just sharing one thing. When the chief guest comes, mostly the people, they wait for him. And then they start checking their watches, how much time else they would take. So you have to bear me out for a few further minutes, sorry, because probably you might be waiting, there will be lunch and so on and so forth. So you have to have a few words for me. I'm just referring to a meeting of mine, I remember years back. We were 4 people who visited University of Oxford and School of Medicine. Where do we stand? Where do they stand? What do we need to do? We have to get certain, I think, inspirations from these kind of establishment so that we also reach those levels. There were 4 delegates, including me. One was Professor Ikrar, I think he is nowadays the chairman of Punjab Higher Education Commission. The third one was Ishrat Hussain Saab, who remained the state bank governor as well. And the fourth one was General Azhar, who was rector of Nust University. We were 4 people, and we were asked that you have to visit different universities for the purpose to learn what they have done and what do we need to do now. So we had a meeting with the Vice Chancellor of Oxford University, and he briefed us about so many other things. The most important thing which he shared with us was that, look, the beauty of Oxford University is we got a distinctive medical school which very often comes with innovations and which is on the top in the world. We are innovating vaccines, we are doing this and we are doing that. It means he didn't refer to the medical practitioners minded. The most important thing for him, for the distinction in the world of the medical school of Oxford University, that was researching which unluckily hasn't been bridged with the medical profession in Pakistan in particular. Another important thing, he said, look, we are giving leadership to the world. And astonishingly, when he calculated and counting that president of this country remained, Clinton was our student, Bhutto was our student, Benazir Bhutto was our student, and then he said Imran Khan also remained our student. This is the beauty of a university. University provides a platform for the researcher to grow. It provides a platform for all these students who study here for the purpose that they have to serve this humanity, as well as it provides the leadership to the nation as well. Really, particularly women, this medical college, I was astonished that so many students have been from this college with degree, serving this country, not only serve this country, as well as other countries across the world. And inshallah, it would continue the same for the future as well. I think, luckily, this is the time we have to learn so many things. And the question is, as a women medical college, definitely we have to focus on our quality education, and it was really amazing and pleasing for me that you are on the top in the QEC ranking. Because I mean, being a vice chancellor since 2012, having almost had tremendous experience as a vice chancellor, now I know QEC ranking matters. It tells you about the quality of education. It tells you about the quality of researching. It tells you about all those standards which have been set by the Higher Education Commission. Few other things which I suggest, madam. This is the first international which I heard, first international conference which is going to focus on bridging the practice with research, which would enable us that we would become more informed doctors in future. I think as a Vice Chancellor University of Peshawar, I am ready for any collaboration, because I think Dr. Ejaz referred to. And believe me, from here I'm saying, because I think been sitting yesterday night with few guests, you visit Bada Gali, this is your campus. I'm telling you, this is your campus. A whole conference is there. You would interact with so many foreigners, because now even today an international conference has been started, and I didn't stay there because I thought you might say, oh, you are late. So just I met them, I said, okay, you initiated, probably I might join you in the concluding ceremony. So I think from now onward, because madam, when you held it, this is not you, I think at the back of it, there are the organizer. Very important, I think it takes days, months, weeks to organize a conference. This is, I think, not so easy task. I know about it. If possible, whenever you get time and you plan, you can hold a part of your conference in Bada Gali as well. Even yesterday night, believe me, madam, I didn't discuss with you, but I told the commander of the Bada Gali that if the guests are coming from Women Medical College, you have to take much care of them. So already I have said it. Madam, a few other things. I'm just referring because I am from the social sciences. And what do we focus on it? I remember there was a conference, an international conference. And I think on the stage, you might have seen so many such kind of things. When the West, they think we are confronted with issues, they conduct conferences. This is so much important, because from today, so many ideas, they would be coming out, and they need to be collaborated together for the purpose that the ideas can be further floated for the purpose how to enrich the policies of ours. So I'm sharing another thing with you. I remember in a Western university, I was there pursuing my PhD. It was a time when HEC was not there. And probably you might have heard that prior to HEC, the PhD concept was not so common. You could only find, even in Punjab University, University of Peshawar, few of the people with PhD. So the question which hit those people, now he is nowadays a professor in Cambridge, they held a conference that why the third world countries are not developing. This is very important issue for the social sciences in particular. And when I say social sciences particular, it does impact the medicine, it does impact the growth of a country as well. So they got stuck. And the title of the international conference was Theoretical Impasse. Oh, there is no theory available at the moment which we can plan to develop the third world countries in the world, particularly Pakistan and the rest. They held the conference, and at the end, I remember at the end of the conference, almost in few days, almost 200-300 papers they were published and started publishing in the international journal, as well as so many books they were started written by those people concerned. Amazing, because they know what do we need to do, and they started thinking about it, how we can now think about these issues and how can we guide our policies as well. And in light of those discussion, series of books published, series of publication made, and at the end, I remember I was pursuing my postdoc that time, they held another conference that we have got a solution now. The theoretical impasse doesn't stand in the world now. Question is, this international conference, it must enable to come up with so many ideas. Where do we stand? Are our doctors informed relating to the latest research? Sorry to say, not 100%. Even two of my daughters, one is pursuing her specialization in gynae, and the second is in the KG.